My name's Curtis Hartman. I was born and raised in central Missouri, a small town called Hartman, Missouri. I went to medical school. I did my undergraduate and medical education at the University of Missouri in Columbia. And then I came to the University of Nebraska for my residency in orthopedic surgery. I took a year and went to Rush University in Chicago, did a fellowship in hip and knee replacement, and since then I've been back here practicing at the University of Nebraska Medical Center. I think I initially became interested in academic medicine when I was a resident. I realized fairly early on that I enjoyed teaching, and so I knew that at an academic medical center I'd have that opportunity. The other thing that really appealed to me was the challenging patients that we get to take care of at an academic tertiary referral center. I really became interested in medicine at a young age. My grandfather was a general practitioner in the town where I grew up. I spent a lot of time in his office kind of seeing the interactions my grandfather had with his patients from afar, and knew that it was a pretty special calling that he had. And so that was really what got me interested in medicine. I guess growing up I was always interested in doing things with my hands. I took my bicycle apart and put it back together multiple times, I'm sure much to the chagrin of my father. But as I got further along in my studies, I realized I was very interested in anatomy and knew that I wanted to study one of the surgical disciplines. And the further along I got in medical school, the more experience I got with orthopedic surgery, I realized that was really the specialty that I wanted to focus on. The majority of the patients I see have either hip or knee arthritis or have had a hip or knee replacement. I take care of a lot of patients who have had a failed hip or knee replacement. That can be because of the implant wearing out or the implant breaking, or an infection, or some other complication associated with that. When I first sit down with a patient, my goal is to really try to get to know that person on a personal level and try to understand how that problem is affecting them in a day-to-day fashion. Once I get to know that patient and really understand how the problem is affecting them, I'm much better able to determine if a surgical intervention is something that's going to be appropriate for that patient.